Welcome, everyone. My name is Dr. Melissa Clarke, and this is another episode of Excuse Me, Doctor. Thank you so much for joining. I hope everyone had a safe, healthy 4th of July weekend, that you didn't do any high-risk activities like block parties or crowded beaches, and that if you did do anything, it was just in small groups, 6 feet apart or more, with your masks on outside and being very safe. So happy that you're able to join us tonight. It's been a very eventful week once again. So when we start to do our weekly wrap up and talk about what happened this week, we have a lot of things that we're going to discuss. And in addition, we have, again, yet another wonderful group of guests tonight. We're going to be talking about women and children's health, and it's going to be in the vein of all the other episodes that we've had that you can go to YouTube and see, or if you're on Facebook, you can go to my Facebook page and see past episodes. We've covered everything from mental health to schools reopening to the business community, and to the faith-based response to COVID-19. So please go back and check out all those things that are on YouTube. And if you go to YouTube, make sure you hit subscribe. And also, if you're on Facebook, my Facebook family, just go to the Dr. Melissa Clarke page and you can go back and see prior episodes. So on that note, we're going to go ahead and kick this off. So again, welcome everybody. I hope you're in a comfortable chair, that you have your favorite snack or beverage, because we're going to go ahead and start right now with the numbers. So as you know, this week we have 2.89 million cases of confirmed coronavirus. We've unfortunately had 132,000 deaths, but over 872,000 people have recovered. But all that, they're staggering numbers, really kind of hard to think about individuals within that. But it's also important to know that we're in the middle still of our first wave. It just extended out from the East Coast and Washington and California, which initially showed some recovery, now to all the states in the middle and the South and the West. And there are 44 states now that are experiencing spikes in COVID-19 cases. And there's a concern that after this July 4th weekend, they'll go up even more. So it's important, unfortunately, to know that Florida is talking about hosting the Republican National Convention in August, and they just added 40,000 new cases just over the past 4 days, with no stay-at-home order in effect, no mandatory mask order. And I'm afraid, seriously, that Republican convention is going to be a disaster, not just for Florida, but for the United States, because all those people are going to be coming in, bringing their coronavirus from somewhere else. And then if they didn't have it, they'll be picking it up at the convention and then going back to their home states and spreading it even more. So let's pray that Florida gets this right, that the convention does not happen in person for the Republicans, and that everyone wears masks and continues to physically distance more than 6 feet in Florida and all the other states that are experiencing spikes. So, D.L. Hughley, we talked about him last week, so why am I bringing him up again? Well, it turns out that not only did he pass out and say, that was basically his one symptom, thank God. So he has essentially remained without symptoms, but has now become a silent spreader because he has spread it to so many people on his radio show. And you know what? There's one person who he did not succeed in spreading it to, and that's his daughter, thank God. And you know why? Because she wore a mask. Out of all the people on his radio show that he came in contact with, she was the only one who had a mask. She's the only one who did not contact coronavirus. So if there is ever an argument to wear a mask, that's one. So please share that widely with all your friends and family and anybody in your circle. Some more news about coronavirus and symptoms. So we knew that it affected the nervous system, but a study actually came out that kind of told us how much and in what way. So we now know specifically that coronavirus is associated with an increased risk for stroke, and that's any kind of stroke. You all might be most familiar with what we call an ischemic stroke. That's where the blood supply to the brain and a certain section of the brain gets cut off, and those might be people that you know who can't use their arm or can't use their leg or can't speak. Other kinds of strokes also include bleeding in the brain. So coronavirus can lead to both of those complications. In addition, and I'm sorry, those complications tend to happen more in people over 60. But there's another way that it affects the nervous system. It's what we in medicine call altered mental status. And it's kind of what it sounds like: confusion or change in personality, change in behavior. And they're seeing that in people under 60. So that can be people presenting with new onset mental confusion, new onset psychosis, which they've never had before, new onset depression, new onset dementia-like syndrome, not actually dementia because it's reversible, or mania. So any of those kind of psychiatric new symptoms can also be seen as a side effect of coronavirus. And again, those tend to be in patients under 60. Now, moving right along to Herman Cain. Wow. So, he got sick, most likely exposed at the Trump rally that was in Tulsa, Oklahoma. He went back home to Atlanta, got hospitalized, and tweeted out the support for the South Dakota event that happened over the weekend with the fireworks and the basically Trump address that happened in South Dakota. My concern about that is, if you are going to expose hospital workers and expect them to take care of you, at least respect the fact that when you tweet stuff out like that, where it's about an event where there's no social distancing, no mask wearing going on, that you're disrespecting the very healthcare workers that are risking their lives to take care of you. And so I just found that's just my rant for the week. I found that highly disrespectful that anybody would do that. But here we are. This is the world we live in, and unfortunately, mask wearing has become very politicized. Other news, hydroxychloroquine. So, that too has become a political football. But there was a study that was done in Detroit this week that over the past few months, they enrolled over 2,500 people, and they looked at how they did either being on hydroxychloroquine or not being on hydroxychloroquine. 56% of the people who were treated were African American. They closely monitored them for symptoms of the electrical problem that happens in the heart as a side effect of hydroxychloroquine. And when they found that, they took them off the medicine. They actually found that the death rate for people who took the hydroxychloroquine being in the hospital was 13%, whereas the people who didn't take it, they had a higher death rate of 26%. So that would seem to say that hydroxychloroquine, in combination with all the other things they did, that wasn't the only treatment they received, appeared with close monitoring. That's important. With close heart monitoring, appears to have a beneficial effect in terms of decreasing the death rate from COVID-19. So something to keep an eye on. Even the people who did the study say that more study is needed to be 100% sure that this is accurately something. Hydroxychloroquine in combination with all the other medicines they got in the close monitoring is something that, will be beneficial in the long run. So those are all our reports for this week, our weekly recap. Let's move on to our weekly debunk. So for our weekly debunk this week, We're dealing with, I read on Facebook that if you took a flu shot in the past 10 years, you will test positive for COVID-19. I can't tell you how many things I get in my inbox and emails and text messages. That's where I get my weekly debunks from everyone, because there are things that people send to me that I can clearly see are erroneous. And so I figure if one person is sending it to me, then that means that there must be some level of confusion out there. So this is what to keep in mind with that and why that's absolutely wrong. First of all, COVID-19 is a disease caused by something called a coronavirus. Influenza is caused by an influenza virus. They're two totally different things. It's like a cow and a horse. They're two totally different things. You wouldn't confuse them, right? Secondly, when you get vaccinated with the influenza vaccine, they use a piece of the virus or the whole virus that's dead or inactivated. Your body mounts an immune response. So the antibodies that your body puts out there, like the soldiers that fight off the virus, they fight off the whatever was injected into you for the vaccine. They kill it, they eliminate it, and the only thing that's left is the antibodies. So there's no way that you would confuse an antibody with another virus, a coronavirus. And there is no similarity between the two. So we can safely rest that debunk and know that there is absolutely no connection between the flu vaccine and having received it 10 years ago or 2 years ago or last year and testing positive for the coronavirus. Furthermore, the person who put that myth out, his name is Dr. Bhutan. He's a discredited doctor from North Carolina. He was reprimanded by the North Carolina Board of Medicine for putting out these kinds of claims and doing sort of uncertain practices that were not based in science. So there's a little bit of credibility issue on that doctor's part. And he's been the main one promoting this theory. So just wanted to warn you about that. And then the last thing on that before we close is that with the weekly debunk is that so many people have gotten tested for the coronavirus and tested negative. Wouldn't you think that a significant portion of those people had received the flu vaccine last year? Okay, so we can put that one to bed. All right, so I would love to move on with this next part of the show, which is talking about women and children's health. So, there's a meme that's going around on Facebook about it's a picture in front of an OB GYN's office, and they're advertising telemedicine visits or televideo visits. And the woman is kind of like looking at it like, how am I going to, see my OBGYN? I'm not going to expose my private parts on camera, right? And she's right. There's certain things that we just can't do over telemedicine. Furthermore, with women's health especially, it's important to remember that women experience symptoms differently than men. So for example, with heart attacks, we learned classically that men or that people experience heart attacks as crushing, chest pain in the middle of your chest. It might go up to your jaw, and you might break out in a sweat and feel short of breath. Well, there have been studies done that show that women, when they experience heart attacks, are a little bit different than that. It might just be profound fatigue, or it might be just arm pain, severe arm pain that is unlike anything that you've had before. So it's important to talk about women's health separate than everyone else. And lastly, with children's health, it seems that children are not getting coronavirus at the same rate, at least severe manifestations of coronavirus at the same rate as everyone else. So it's also important to talk about, for example, the multisystem inflammatory disease that children do get as a result of coronavirus, or are infants at risk for coronavirus when they're first born. So in order to deal with all those issues, I had to put together a fantastic panel for you tonight. The first person I'm going to bring on is Dr. Aida Martinez. She is a board-certified pediatrician who's been in practice for 26 years. She first worked in community health clinics and then moved to Kaiser, where she was for many, many years. She's passionate about preventive health care, about volunteering and teaching, and she's gotten numerous awards for providing compassionate quality care. Welcome, Dr. Martinez.
Hi, Melissa.
Good to see you.
Good to see you as well.
Our next guest is Dr. Carol Brown Elliott. She is double boarded, everyone. That means that not only is she an expert in one specialty, she's actually an expert in two specialties of medicine. OB/GYN is her first, and her second is maternal fetal medicine. And I'm going to have her explain what that is when she comes on. She's traveled, she's been in private practice for 24 years. She's in Dallas, and she is passionate about helping her patients understand the impact of nutrition and lifestyle and their role in reversal of disease. So we hope that she will mention that as well tonight. Welcome, Dr. Brown Elliott.
Hello, Melissa and Aida.
And last but not least, we have Dr. Pamela Singleton. She is also an OB/GYN who practices in the San Francisco Bay Area for over 25 years. She's traveled extensively outside the United States. She's performed medical missions all over the world, specifically surgeries for women who otherwise would not be able to have access to medical care. Welcome, Dr. Singleton. Welcome to you all. We're really happy to have you tonight.
Thank you.
And I have to say, this is a very special show for me because one thing all four of us have in common is we made the journey through medical school together. And this would have been a anniversary year for us where we should have gotten together at a reunion, but it was canceled because of the pandemic. And so we get to meet here for you guys' benefit out on YouTube and Facebook. And so we're going to have a great show, and I'm going to kick it off with a question first for Dr. Singleton. So, Dr. Singleton, can you tell me, what are you telling your pregnant patients about COVID-19, given the recent findings that women who are pregnant appear to be at higher risk for severe complications from COVID-19 as compared to non-pregnant women?
Well, first of all, it is important that they know that as opposed to their non-pregnant counterparts, that they are at increased risk of getting quite severe if they get infected. And one of the things that pregnancy predisposes you to is being hypercoagulable, where your blood clots. And with COVID, that also causes hypercoagulability. And so pregnant women are at increased risk of having clots, VTEs, which are clots either in your legs or in your lungs, and those can be fatal. So it's very important that they avoid infection, do the proper social distancing, hand washing, and just try to avoid, getting sick.
So prevention is the most important thing in pregnancy. And
Yes.
I know in pregnancy, it's important to avoid infection in general.
Right.
So Dr. Brown Elliott, you practice something called maternal fetal medicine or high risk OB. Can you tell us what that is?
In gynecology.
Can you repeat the first part? Your audio hadn't caught up.
Okay. Yes, I said maternal fetal medicine is a subspecialty of obstetrics. And what we do is we take care of high risk pregnancy and patients with medical complications, and also women who might be carrying a fetus that has a birth defect. The most common reason that we also see patients, or one of the more common reasons, is for advanced maternal age, different medical complications like diabetes, hypertension, hypothyroidism, systemic lupus, erythematosus, any complex medical condition. I spend a lot of my time doing high level or high degree ultrasounds, looking specifically at each fetus, literally from head to toe, looking at the brain, at the face, and at the heart chambers, and making sure that
the baby is developed properly, looking at the liver, the kidneys, counting fingers and toes, and will not so much do procedures, but at the beginning of my career, I did quite a bit of procedures, amniocentesis. I've done cerclages. So it's really the type of doctor that deals with any high-risk complication or any more specialized procedures on pregnant patients.
Great. Thank you for that summary. So, would you say that if someone got sick with COVID-19 while in the hospital delivering, they would see you?
Absolutely.
And so, have you seen patients? I know I should mention too, you're in Dallas, Texas, which we know Texas is a hot spot right now. So, have you seen patients with COVID-19, and can you describe some of the complications that you might have seen?
Yeah, so the sickest COVID patient that I saw was pre-hotspot days. And this was a woman in her late 20s to early 30s. I don't remember specifically, but she had come into the hospital because she just didn't feel well. She had muscle aches, and she had gestational diabetes, which is, quite common, but in pregnancy. And about 3 to 4 days after being in the hospital, she literally and all of a sudden developed difficulty breathing. And it was at that time that I was called. And by the time I made it to the hospital, she was on a ventilator, literally fighting for her life.
Wow.
And my role at that time was to go in, do an ultrasound, assess the baby, and come up with a plan. And one of the most important things that I find myself pointing out in the intensive care unit is a reminder that the physiology of the pregnant woman is different, specifically as it relates to how much carbon dioxide is in their blood. And a pregnant woman's carbon dioxide level is much lower than the non-pregnant woman. And this woman's carbon dioxide level was getting to the higher range of normal. And so it was imperative that I get with the ICU doctor to review all that so that we could get the ventilator settings established. And the bottom line with her is not long after I left the hospital, she decompensated, had to be delivered. And of course, interestingly enough, after delivery, we were better able to ventilate her after we removed that baby and that uterus that was so big that it pushes upward on the lungs. And so after the baby delivered, the uterus decompressed, and so we were better able to ventilate. She stayed on the ventilator for about 10 days, and she and baby both are healthy and went home.
That's great. And that's important to know, everyone, that even though pregnant women are at increased risk, what I believe has been shown thus far, because, this is an evolving story with this coronavirus. Thus far, it does not appear that pregnant women are at increased risk for death above anybody else. So I think the fact that the story that Dr. Brown Elliott just told, the fact that she survived and eventually, did okay and was able to leave the hospital is sort of on par with some of the other cases of pregnant women getting COVID-19 that we're seeing.
May I mention, Dr. Clarke, that in addition to the hypercoagulable state, COVID also predisposes pregnant women to preterm birth and preterm labor. And in that sense, that's when we would call Dr. Elliott in to, if someone's before 36 weeks, it's considered preterm. And then the high-risk pregnancy physician would then come in and take over as well.
Great. Yeah, that's absolutely important to know. So let's move to that period when the baby's been delivered. And we're now reaching out to Dr. Martinez. So are infants at any increased risk for COVID-19?
So what the latest studies have shown is that the under 1-year-olds and over 15-year-olds are the highest risk. However, they tend to get very mild disease. And so the deaths in that age group have been pretty rare. At our facility, we were testing all the moms coming in to deliver, and They picked up a couple of asymptomatic moms, separated baby from the mother at delivery, and then had the mom self-isolate away from the baby for the 2 weeks. There was just a new study coming out of England that said that that probably wasn't necessary, that they had looked at moms who continued to breastfeed and were not separated from their babies, and very on the numbers that they had, I believe only 2 became COVID positive, but they also appear to be horizontal transmission from other family members.
What do you mean by horizontal transmission? Can you break that down a little bit?
So the debate has been, is the virus transmitted to the baby during the birth process, which would be considered vertical transmission from mother to baby, or is it horizontal transmission once the baby is out? Is it contact either from a family member or from the mother? So more direct contact versus an infection as part of the birth process.
Right. And I think that's so important. You know, the separation that we're having to go through is really, for any age group, I think it weighs on our mental health. But I would imagine for an infant just born to be separated for 2 weeks from their mother, you know, as you said, is that really necessary? I think that's important to keep in mind. And
I
then,
think that, I'm sorry.
no, please go aahead.
I think that they've shown if the mother is doing proper, hand washing, if she's using something, either anything to cover her mouth, that spread is very low. And there is no spread via breast milk. They've done studies to show that it's not transmitted via breast milk. So even if they are separated, they can still continue to pump and give it to the baby if they are separating. But it's not transmitted via breast milk. So that's another good thing to know.
That is a great thing to know. Absolutely. And then for infants and up of all ages, Dr. Martinez, you know, we heard a few weeks about the multisystem inflammatory syndrome. And then we heard about some cases in New York, and then we really didn't hear that much about it after that. So can you give us an update? Is it a thing? Is it still happening? What is it?
So it is a thing, incredibly rare, about 300 cases in the country. One at our facility, and I believe 2 at the Children's Hospital in San Diego. All have survived, especially now with early recognition. And they're treated very similar to how Kawasaki disease, which is an older, well-known and detailed disease, is treated.
Okay, great. And just, can you refresh everybody on what the symptoms are?
Yeah, so what the disease appears to be is inflammation throughout the body that occurs several weeks after the child has had coronavirus. And so when these children were coming in and getting tested, they were negative for active coronavirus infection. However, when they tested them for antibodies, a huge percentage of them, not all of them, but a huge percentage of them had developed antibodies to COVID. And so they linked it to the coronavirus. Now, still, because there's so few cases, it's unclear whether the coronavirus in susceptible children then activates this immune response, which causes inflammation throughout the body, particularly the heart and the kidneys. Skin manifestations are very common. And so the children will present with an appearance that's very similar to sepsis. They'll be having difficulty breathing, their blood pressure will be dropping, they'll have a skin rash like one that typically you don't see in children. It's a very intense skin rash, and their heart system will continue to deteriorate if they're not treated promptly.
Right, but it sounds like, again, early detection. So if you see, obviously, any of those things, which we know are very rare, but if you see any of those in a child, especially one who you know has tested positive for COVID, it's important to get to your pediatrician right away. So I want to go back to you for a second, Dr. Brown Elliott. You're in Dallas, and you mentioned that you see patients who have other medical problems that might make their pregnancy more difficult. You mentioned lupus, you mentioned diabetes, you mentioned high blood pressure. And those are the same underlying conditions that where you would see more severe manifestations of COVID-19. What do you tell patients in your practice in terms of maximizing their health so that they minimize the effects of those diseases on their pregnancy and also, in an associated way, minimize the effect of getting severe COVID-19?
Yeah. So yes, I actually spend probably the first several minutes of any encounter with my patients talking about food and nutrition. The impact that unhealthy eating has on the pregnancy can be profound. It can include risk of even fetal death, and there are also reports of increased risk of ADHD, autism, learning disabilities, and it all starts in pregnancy. And so what I talk to my patients about is the importance of optimizing their nutrition choices. And I get very specific because there's so much confusing information about what's healthy to eat and what isn't healthy to eat. And everyone knows that the healthiest food on the planet is green, leafy greens, and any green vegetable. And I literally give out a very detailed meal plan about what to eat for breakfast, what to eat for lunch, what to eat for dinner, and for my diabetics, what to eat for a snack. And what I recommend is predominantly whole foods and plant-based, which basically means beans, leafy greens, quinoa, brown rice. Try to avoid dairy products as well as meat, because as we know, animal products are associated with inflammation. And one of the major issues with COVID-19, severe disease in COVID-19 is the intense inflammatory response, which is the cytokine storm. And so one of the ways to get inflammation down in the body is to eat a predominantly whole foods, plant-based diet, which is basically an anti-inflammatory diet. But when one is consuming predominantly meat and dairy products and crackers and cookies and cakes and pies and ice cream and pizza and tacos, all the quote good stuff, which is really not good.
Yeah.
That is actually a pro-inflammatory disease.
Great. Preach
Or
it, doctor. Yeah.
Pro-inflammatory diet, I meant to see.
Right. Right. And,
Um,
I've been telling my viewers, for weeks about that. Thank you for restating it so eloquently. And I think, the more you hear it, the more it makes sense.
Well, Dr.
And
Elliott, you'd be happy to know that on my initial OB visit with all my pregnant ladies, that I do go into detail on diet, and I do promote veggies. I don't cut them out on their meat 100%, but I do have them cut back on red meat. And I also talk to them about fish, because the fish in the Bay Area and shellfish in the Bay Area have higher mercury levels that can increase your risk of both miscarriage and stillbirth. So I do spend a significant amount of time talking about diet and exercise as well. Because
very
exercise,
important.
And
and
I
the
think it's
diabetics,
important.
exercise helps
Mhm.
control their blood sugars as well.
Yes,
And I
very
think it's important, if just a second, that I really emphasize to patients that they can avoid medication completely. They can avoid antihypertensive medication. They can avoid diabetic medication. They can avoid lupus flares by simply changing how they eat. And it's important to understand. Someone asked a question about fish, and Dr. Pam mentioned fish as well. And the reason that animal products are not healthy is because they cause release of a hormone called insulin-like growth factor 1. And insulin-like growth factor 1 is a very strong promoter of growth. So if you have cancer, precancerous conditions in your body, when you're consuming animal products, it will promote growth of those precancerous tumors, or if you already have a cancerous tumor, it will promote growth of that cancerous tumor. Whereas when you eat leafy lean vegetables and plant-based foods, beans, quinoa, actually the blood from vegans kill cancer cells. It's incredible. It's incredible.
Yeah. Thank you, Dr. Brown Elliott. Yes, those things are true. And I want to underscore that, they're talking about what they tell pregnant women, but these things are important for women's health overall, whether you're pregnant or non-pregnant at any age.
Absolutely.
And so it's important to also keep those in mind. I wanted to go back to, first of all, I want to encourage everybody, remember to type in your questions for the doctors because we're taking questions. But I want to go back to Dr. Martinez for a moment. You are in San Diego, which, California did great initially, but now it appears, especially Southern California or different places in California, to be increasing in terms of the number of cases of COVID-19. And we know that it affects Black and Latino populations much more than other populations. Have you seen effective ways to get the message out to different communities that are disproportionately affected, Dr. Martinez? In California?
It's been very hard. Initially, California was one of the first to lock down and started gradually opening up. San Diego had been doing great, and then today it went back to a partial lockdown and is being monitored due to the increased number of cases. A lot of it has been due to the fact that it's become a political issue. And so and San Diego is a younger population. We have a lot of college-age students, and they just started developing COVID fatigue. The beaches have been more and more crowded. The messaging really needs to be a consistent message: to wear the mask, to use hand sanitizer. If you're out and about in the community, we're seeing about 50% of the people wearing masks, and the other 50% are not, unless they're obligated to by going into a store. And then, to answer your question, the population that's been the most affected in San Diego is the Hispanic population, because that's a large percentage of the San Diego population due to our proximity to the border. And as hard as you try, people get together, they start, drinking, and a lot of them live in close quarters. And so they may start with the mask, but you gradually see the masks come out. I have some of my patients that had opened a brewery right before coronavirus hit, and they had been trying to follow all the recommendations. And he says that the owner says that as soon as the young people have one drink, the masks come out. And so, it has to be a unified message, and I think we're not getting that in this environment. And as long as we don't get a unified message on the importance of masks, on the importance of washing your hands, on the importance of social distancing, it gets lost. And then I think the Hispanic population also may not have as much access to the internet. They might not have access to healthcare and be talking to their doctors. And so those are some barriers.
Yeah, one of the statistics that I've been saying is that 4 out of 5 Black and brown people are frontline workers. Yeah. So where many people have had the luxury of being able to stay at home and, shelter in place, a lot of Black and brown people have to go to work every day and either take public transportation or carpool with other people. And then when they get to their frontline jobs, they're, out with everybody else. And I think that's also too important. You mentioned the role that alcohol plays in any population, really, in sort of disinhibiting you and making you forget what you're supposed to do, which is why I think it's so important in states where things are skyrocketing to keep the bars closed until community spread is such where it's safe to reopen. And unfortunately, bars and restaurants are losing a lot of money, but, you can get money back. You can't get life back. That's what I
Yeah,
always say.
even
Excuse me, doctor.
even in our pregnant population, the numbers are pretty much the same. Between January 22nd of this year and June 30th, there have been over 10,500 women, pregnant women with COVID, and of those, Hispanics are at the highest with over 4,700, followed closely by African Americans at about 1,700. The lowest has been in the Asians, which are about 301. So even amongst pregnant women, we're still seeing highest numbers in the Hispanic population, followed closely by African American women.
And I think that, I mean, you guys, just to be clear for the listening audience, Dr. Martinez and Dr. Singleton are in California. Dr. Martinez in Southern and Dr. Singleton in Northern California. So there are larger Latino populations in California. So the numbers are definitely disproportionate, but a little different, I think, than what we're seeing, say, on the East Coast, just because of the population differences.
Excuse me, doctor. There's a question. Who is allowed to attend mom in labor? Who is allowed to attend moms in labor? If the partner is allowed, is that person tested for COVID?
Well, I think that depends on what institution you're at. Even some variation here in Northern California. At the hospital that I deliver at, there's only the father is allowed. And once he comes into the hospital, he cannot leave. So if she has a cesarean section and is there for 4 days, he has to stay for 4 days. If he goes home, he's not readmitted. They are not testing the partners. They're not testing the pregnant women either. The only patients they are testing are those who are coming in for scheduled cesarean sections or scheduled inductions of labor. It's hard to test because you test someone and they may not go into labor for, another 2 weeks. So I deliver at a Sutter system, and at that particular hospital, that's how they're doing it. There are other hospitals here in the Bay Area who are not allowing anyone in with the patient to deliver. But I think some of those policies are changing to allow the fathers at least.
And when you say fathers, if there's no father, for example, in the picture, can the mother designate who, one person, if there is no father in the picture?
In Dallas, we test everybody.
That's
If
good.
you come into the hospital to be, whether it's if you stubbed your toe and you come in and you're more than 20 weeks pregnant and you come up to labor and delivery, you're going to be tested for COVID.
Right.
You're allowed one support person and they will be screened with the questions. Exactly. Mm-hmm. And then we just recently started allowing a support person as well as a doula, because a large proportion of our patients want doulas, and it was they were making decisions about delivering elsewhere if they were not allowed the doula.
Right. And just to be clear, that's a rapid screening test, I'm assuming that they're doing?
Yeah.
Yes, they're doing the PCR.
Right. Well, the PCR, there's some PCRs that take 45 minutes. There's some, like I know
It's
at Stanford,
rapid.
there's a
Yes.
rapid one, right?
It's
That's 45
rapid.
minutes. Okay.
Mhm.
Okay.
For most people out in the community, what they're getting when they go to urgent care is one that takes 2 to 3 days to come back.
Right.
So, yeah.
Right.
All right. So, back to Dr. Martinez. One other question about pediatrics, about children and this whole returning to school issue. So the American Academy of Pediatrics, so for everybody, that's sort of the group of that all pediatricians, many pediatricians in the country belong to, and they're a specialty society. They issue recommendations that are, taken with some degree of seriousness by policymakers. So the American Academy of Pediatrics came out and said that children should definitely go back to school in the fall for their mental health, if for no other reason. But we know that teachers are not really feeling that. So as a pediatrician, what are your thoughts about that whole controversy? What do you think is more important, that children go back to school, or the fact that many teachers might be at risk?
So that's a great question. The AAP issued the statement, and the amount of chatter between pediatricians back and forth was amazing, most in opposition of it. when the coronavirus first became a common word, the schools closed immediately and children were not being tested. And in general, since they get mild disease, they wouldn't have been the first group to get tested. And then parents were actually very good about keeping kids sheltered. They were afraid for their kids. And so it stands to reason that children really weren't infected during the shutdown. Now that schools and daycares are going to start reopening, and in Texas, daycares have opened. And I believe as of today, there's close to 1,300 children and daycare workers infected in Texas. And so it only stands to reason that as soon as children go back to school, they will probably become infected, be asymptomatic carriers, probably if they get disease, get mild disease, but unfortunately bring it back home to their parents and their grandparents and other relatives. So I think most pediatricians feel it's not safe. You can't really ask a kindergartner to social distance. Those of us that work with children know they're constantly have their fingers up their nose, any body part that they can access, their fingers are in there. And so it only stands to reason that they're going to share the coronavirus. And, children there's coronaviruses, other types of coronaviruses that have been out in the community in the past that cause very, very mild disease. And children, when we did respiratory panels on them,
the common cold is a coronavirus.
Exactly. Yeah. And so when we've tested children that ended up hospitalized and had a respiratory panel, we picked up coronaviruses all the time. Why this one would be different doesn't really hold that it will be different.
All right.
Excuse me, doctor. We have a question coming from Renee Roxborough Moore. Dr. Martinez, what are the methods that can be used to encourage young children to wear masks? Is it quite difficult for kids between 2 and 8 years old to keep them on?
It's quite difficult for doctors to keep them on all day. So yes, it's pretty difficult. If it becomes a lot of positive reinforcement, I have a 2-year-old niece and she loves wearing her masks. Her parents have gotten her different characters. She sees everybody in the family wearing a mask and everybody applauds her when she puts it on. And she's 2. The older children, I think you risk, you don't want to instill too much fear. I think there's a fine line about how much you tell them. And so you don't want to instill so much fear, but you do want to kind of almost emphasize that it's to protect those around them, to protect their grandparents who could become very sick and not so much themselves. So in our clinic, all children over 2 were required to wear a mask when they came in for the past 3 months, and they all did. And the more they got used to it, the parents said, the easier it was for them to keep it on. And I think part of it is just the positive reinforcement.
Excuse me, doctor. We have another question from Lori Brown. What is a doula?
And I think Dr. Brown Elliott, you mentioned a doula that a lot of your population in Dallas uses them. So can you break that down for us?
Yeah, a doula is someone who is certified to be a support person for someone who's laboring. And they're an advocate. They advocate for the laboring woman.
What do you know? What kind of training process do they have? Can I just wake up one morning and say I'm a doula?
I have no idea.
I don't know.
I know they don't go to medical school. That's about all I can tell you.
Right.
Yeah.
Excuse me, doctor. We have one more question from Renee Roxborough Moore. Animals raised organic, do they still contain that growth hormone you were talking about?
Yeah.
Go ahead.
Yeah. So it's not that the animals contain the hormone, that hormone is within us. It is a response to animal protein in our bodies.
Right. So I think that made it clear, but just to add to that, what Dr. Brown Elliott was saying is that when you consume animal protein, your body has an inflammatory response, whether or not that animal has been raised with steroids or antibiotics or any of the other things that, large scale farming does to animals. So regardless, there is that certain response that our bodies have that can promote growth of tumors, whether they be cancerous or non-cancerous tumors in our bodies.
Excuse me, doctor. We have a question from Peter Williams. Does that response include fish protein, seafood?
Yes, any animal protein, doesn't matter who the animal's from, what kind of animal, it doesn't matter. And if you want more, to read more, there are several physicians who've put out wonderful books. Dr. Joel Furman has a great book out that I think all of us should read. I've got it right here. It's called Fast Food Genocide. I don't know if it shows up, but he discusses
Lift it a little further, a little higher. There you go.
Insulin-like growth factor. Dr. Michael Greger has a book called How Not to Die, again, discussing this insulin-like growth factor. Dr. John McDougall, all the lifestyle guru physicians speak to the fact that the reason any animal protein is harmful and is due to the fact that it will stimulate growth. And the main growth we're concerned with is tumor growth. And even like fibroids, right? Uterine fibroids, fibroid tumors in the breast that aren't necessarily cancerous, but it's still an abnormal growth.
Right. And in Excuse Me, Doctor, the book, I talk about a lot of the issues around diets that promote inflammation. I believe, though, that for some people, they're not going to be able to cut out meat. And in that case, I think it's important to limit your red meat intake as much as possible. Focus mainly on fish and seafood, which is still inflammatory, but less so. And also does have other benefits like vitamin D and omega-3s. So if you're not ready yet to go all the way vegetarian or vegan, realize that it is a sliding scale, and the more that you can do in terms of eliminating red meat, the better.
Yes, and I think it's important to point out, I didn't know this until, I don't know, a year ago, but red meat is considered a class 1 carcinogen, just like asbestos, plutonium, and tobacco. And so red meat is pretty serious. And of course, it's just important to know. And then you make the choice. And there's some who feel that for those who cannot give up meat, it's probably, the largest amount per week one should consume would be about 6 to 8 ounces a week.
Right, which is basically like 1 or 2 servings. And the more green leafy vegetables you can substitute for it, the better. So I wanted to just move on to one item around mental health, which I think is really important. We've been seeing that with the social isolation that we've had, especially for women who, we're sort of, the stereotype is we're the more social and that's how we interact, but especially for pregnant women who are higher risk for postpartum depression, obviously after the baby is born. How are you screening for your patients for that possibility? They've gone through their entire pregnancy. They may have been isolated from their normal support system because they've had to stay, quarantined away to protect their health. Now they've delivered. They don't have that same support system that they might normally have. What are you telling your patients up front? How are you looking for signs of depression or decreased mood in among pregnant women and postpartum women?
Well, at our 6-week postpartum visit, and 6 weeks is far out, but at our 6-week postpartum visit, we administer a special test called the Edinburgh Depression Scale. And there's a number that we calculate. And if you're above that number, then you're at risk or you're considered depressed. And therefore, we would then refer them out for counseling. If someone's really depressed, I start them immediately on an antidepressant and then get them in as soon as possible for counseling. But I have seen an increased number of women feeling bluesy because of the COVID pandemic and being shut in and not having access, and feeling overwhelmed. It's an overwhelming condition as it is to be postpartum and have a new baby and not getting sleep, and but it has been more difficult during this pandemic. So it is important that we administer those questionnaires and make sure that we're picking up on some that may have just subtle depression or maybe heading in that direction, to try to combat that.
Yeah. And Dr. Martinez, you mentioned as a pediatrician, you screen for that too, right?
Yeah, a pediatrician really becomes a second mom to a lot of these young moms, and more so over the last few months. I had quite a number of young ladies that delivered, and their own moms were not able to come and be with them because they were in another part of the country, and then wanted to be safe, didn't want to get on an airplane. And so I felt like the last 3 months I was getting a lot more emails. I was doing a lot more phone visits. I was reassuring the moms. We do have a pretty robust mental health clinic that was doing a lot of telemedicine with the young moms, so we would hook them up with that. And we really are the ones that see the babies and the moms shortly after delivery. They come into our clinic at the 2 days after delivery or discharge from the hospital, again at a couple of weeks of age, and then depending on how they're doing, every couple of weeks after that.
Excuse me, doctor, we have a question, and this is our final question. It's from Angela in Los Angeles. Is it possible not to be deathly sick if you contract COVID, or is it really the luck of the draw?
Who wants to answer that?
Dr. Brown Elliott, or would you like to take that being in high risk OB?
Can you repeat the question?
Is it specific to pregnancy or just in general?
It's in general. It does not say, is it possible not to be deathly sick if you contract COVID, or is it really the luck of the draw?
Okay, I'll go ahead and take that one. So yes, it breaks down to about 80% of people who contract COVID-19 will do just fine. About 20% will end up in the hospital. And of those who end up in the hospital, of the entire population, about 1% of people will die. Now in the hospital, the 20% who end up in the hospital, so most people will go home. But it depends on your age. People who are 80 and above have roughly about a 15% mortality. And it gets lower from there if you're 70, between 70 and 80, between 60 and 70. There's lower mortality for each of those. As far as being able to predict who will not do well, people with underlying health conditions and people over 60 years old, and those underlying health conditions, again, diabetes, high blood pressure, heart disease, lung disease, kidney disease, autoimmune diseases like lupus, rheumatoid arthritis, sarcoidosis, and immune system diseases like HIV, those individuals will tend to be sicker with COVID-19 than somebody who is healthy and younger. We also heard, though, from Dr. Martinez that children also can get something called a multisystem inflammatory disease that's a delayed finding after a child has probably had a silent case of COVID-19 or asymptomatic case, that a week or so later, they may develop this overactive immune response that then attacks their body. But again, that is a very, very small percentage. Staying healthy as possible boosting your immune system during this time, eating an anti-inflammatory diet, exercising, getting enough sleep, drinking enough water, basically the 5 self-health actions that I talk about every week are the best way to boost your immunity and decrease chances that you will contract COVID-19 and be sick from it.
Yeah, I think a question came up. I know that was the last one, but there has been some discussion about blood type and people doing worse according to their blood type. Can you speak on that, Dr. Clarke?
Sure, Dr. Singleton. Actually, I spoke about it last week. I would encourage everybody to go back and listen to the weekly update from last week. I talked about that ABO blood type study, and that so there is a chromosome that has your so part of your genes that has the variation as to whether you're A, B, or O, and right next to that appears to be a piece of DNA that's associated with being higher risk for getting severe manifestations of COVID-19. That variation is seen most often with blood type A and least often with blood type O.
Oh.
However, there needs to be, again, a lot more study to determine, is that a real association or that was just because they didn't look at enough people. But for now, that's what we know. So I think that is it for our questions. Man, this has been incredibly fun. And I've been calling everybody doctor, but it's Aida, Pam, and Carol. And I just want to thank you guys for taking the time, for answering all the questions. And it was wonderful to see you. We learned so much tonight, I think, about where we are in this pandemic, the importance of the fact that the doctors are in now. People are opening their offices back up, whether they be pediatricians, OB GYNs, primary care doctors. It's important, everybody, to get back to your regular scheduled medical care, because we can't put these things off forever, like mammograms and pap smears and our routine checkups and immunizations for our children. There's some things that can't be done with telemedicine, so it's important to call your doctor, make that appointment, go ahead and be seen. Your doctor's offices are taking precautions around providing care, scheduling people, having you perhaps maybe not wait in the waiting room, but wait out in your car until you're called in. Different people are doing it different ways, but know that it's very important to still go back and resume your normal medical care, because we want to make sure that everyone stays as healthy as possible, and those things that can be detected early or prevented, that they be detected early and prevented. And, we had some great wisdom and great discussion about the importance of nutrition. I'd love everybody to keep that in mind. And I want to thank again my guests for being here. And I also want to thank you all for listening in. And until next week, we'll be back again Monday night, 9 p.m. East Coast time, 6 p.m. Pacific time. And until then, remember, be wise, be well, and be health empowered.